Dr. Anurag Gupta, an airway orthodontist, and I am a dentofacial orthopedic also. I can bring about changes in the jaw so that the children can breathe easily while they're sleeping. Do you know that these days, due to air pollution and allergies, a lot of children are facing issues of mouth breathing, and which is because of blocked nose, and these children, they snore a lot in the night. And when this problem persists over a long time, then the development of the nose and the jaw and the face, it becomes very long, and the children have a typically very long nose and a very narrow face, and their jaw is also very narrow. And what happens is that these children tend to have a predisposition to oral sleep apnea, which is snoring in the night, and the brain does not get enough oxygen in the night. So, if we are able to take care of these problems of the blocked nose and the airway at an early stage, then we can prevent a bigger problem which can develop later. And this can be done through a visit with airway orthodontist, who can do your sleep study and airway volume analysis and can tell you what is the problem. So if you think your child has some snoring or mouth breathing issue, then do visit your airway orthodontist as soon as possible.